First of all, thank you so much for being here. I'm going to ask a lot of questions which I have had with respect to oral health, with respect to teeth, with respect to a lot of other hygiene habits. But before that, I really must say the first time I came to your clinic, I came there with an intention of I really want to start changing how my teeth looks with respect to the whiteness of it or the cleanliness of it. But you looked at me and you said, both me and my husband, saying both of us have crossbite. And I was shocked because I have been to a dentist previously in 2019, but nobody spoke to me about it. And you also asked me, Gayatri, do you have headache? I said no. You said there is a high probability that you will start developing headache, and that's when you recommended we go in for the Invisalign journey. I want to understand what is crossbite and how is it connected to headache?
So, your bite and the way you close your teeth and open your mouth, that guides your joint, right? So, you have your upper jaw, and upper jaw is fixed to the head and the skull, right? And your lower jaw is moving through the joint here. So, it moves like a hinge axis,
Okay.
right? So, and that axis, and that is guided by your teeth. So every time you have a crossbite, you adjust and then close every time and then open,
Okay.
right? So that causes your joint to deviate every time, and all those muscles that are activating the joint, those will be in strain. So when you say headaches, and these headaches are actually muscular pain that are activated from these musculatures which are here.
Okay.
When you say temporalis, and all these are muscles that move your lower jaw.
Okay.
So those would get pain, and you sense it like a headache.
Okay.
And most of these are mistaken as a migraine headache or as a sinusitis headache because it comes around the eyes or in these areas, and sometimes even as a neck pain.
Okay. So all the patients that you consult, like if you have to take an average number, how many people actually have crossbite issues?
Crossbite issue would be there 30% of the population,
Okay.
and 80% of everyone who sends it as a migraine headache actually have TMD. So TMD is for temporomandibular dysfunction.
Okay.
So again, temple is this area, and mandible is this bone, and anything that alters the function,
Okay.
it can have any issues with the headache, and in rare occasion it can even cause vertigo.
Okay. And this can be corrected with children. Like since when we were children, we can correct this.
Usually these headaches show up after the age of 25 to 28.
Okay.
Until then, the body has the resilience to again cope up. The bone is growing, and your joint is again modifying itself. So it has the ability to adjust.
Okay, that's quite interesting. And also, when you came to office, we were talking about coffee and sugar and all of that. You were very particular about no sugar. And when I asked you why no sugar, you spoke about the frequency of consumption of sugar. I'd love for you to educate people on this. Is sugar bad for the teeth, or the frequency of consumption of sugar is bad? And talk to us about the pH and what it does to the teeth.
Okay. And when you say coffee, it has two agents that can hurt.
Okay.
One is coffee itself because it's a little acidic,
Okay.
and that goes away when you add a little bit of milk. That's one.
Okay.
So in that sense, milk coffee is slightly better than the
Black coffee.
black coffee because it's less acidic. About the sugar, the amount of sugar doesn't matter on your teeth.
Okay.
It's only about the frequency of sugar that you take. Again, coffee, if you are taking at least 4 to 5 times a day, and that's actually frequented every 2 hours. So every time you have coffee or a tea or anything that has sugar, it reduces the pH of the mouth. So every time it reduces the pH, it gets into the acidic state. That acidic state, it initiates dissolving of the teeth. It leaches away the calcium ion, and your teeth gets more porous. Any porous teeth, it has the ability to accumulate more stains,
Okay.
and that gets into the state. So from the state of a tile, it gets more like a marble. So
Okay.
it gets in more stains. Over the time, that discolors the tooth.
That's why the yellowish thing happens.
Exactly.
So any kind of a drink which has color in it, like tea, coffee, any aerated drinks, they have the same effect on the teeth.
Same effect.
Okay. And if at all I'm taking coffee and I don't want my teeth to be affected, what is the precautionary thing that I can do?
You can add a dash of milk. So I like espresso, but I don't like the acidic nature of the espresso. So I add a dash of milk to it. It reduces the pH. And as soon as you have your coffee, you can swish your mouth. And that helps. And brushing soon after your coffee is not very good idea because already you have reduced your pH. We don't want to hurt the teeth more when it is in the acidic state.
Also, most people think dental health is only about teeth. Is it true that it is only about teeth, or what are the hidden things that are there beyond dental health that if you don't take care of this, that also gets affected?
Okay. Our teeth are like plants. Those are planted in the soil.
Okay.
And the soil is the bone.
It's the bone.
Exactly.
Okay.
And you have the gum that is like a skin on top of the bone.
Okay.
Right. So the most important part is the supporting structure also need to be taken care. Right. So, and that will be taken care only by cleaning those areas, because only area that is accessible to us is near the teeth. So and the most important area is also around the teeth, in between the gums and the teeth.
Okay.
So if you have some dirt there and if it is not clean, and the bacteria engages itself there, it forms colonies, and that will grow, and that will cause more the toxins to be released.
Okay.
And that will cause more inflammation around that area. And that inflammation, if it is there for a very long time, it gets into the bone, and the bone reacts to that by dissolving itself a little bit, reduced over the time.
Okay.
And that loosens the teeth.
Okay.
And surprisingly, this is seen more in anyone who has excessive stress. Again, because they have cortisol in their bloodstream, and that cortisol numbs their immune system.
Okay.
So the body has the ability to get attacked by any bacteria.
Okay.
So, and this is also called trench mouth syndrome.
What is it called?
Trench mouth syndrome.
Okay.
So, if anyone in the excessive stress, and that's seen in soldiers. So, again, those days, soldiers, when they're back from any battlefield which has a lot of stress involved, they have excessive bone loss. And that will cause loosening of the teeth, and they lose their teeth even in the age of 25. I've seen patient who has excessive stress, again clinical amount of stress, not the usual work stress that we all have. The clinical amount of stress and depression also cause the tooth issues.
Oh boy, this is quite shocking, because people think mental health issues, okay, it affects the body, it affects the other organs, but it's very rare that people think it also affects the quality of your oral health.
It's easier to sense any issues in the body from the teeth. Even your diabetes shows up in your teeth very early.
Okay, help us understand that. How do we figure out?
You will start having minor pustule nodules on your gums, which again means your blood sugar levels are way too much increasing and reducing, and your insulin is not able to handle that. So those will cause any gum issues. Gum issues would be the initial few indicators of diabetes. I have informed a patient who is again 58-year-old, who was otherwise very healthy. I just asked her to, would you please just go and check? And her HbA1c level was around 11.
You were able to find that because of the gum health.
Gum health.
Okay. This brings me to the next question. I mean, I was discussing with you also. The first time I came to your clinic and you told me, Gayathri, you have crossbite and we might have to realign it. And are you open to removing the wisdom tooth? I was so scared because I'm generally very scared of pain. And the week before the wisdom tooth removal, in my mind, I mean, it might seem like a trivial thing for a lot of people, but I'm very, very scared of it. But when I walked in, the procedure that happened, the people, and the doctor who was there. The entire process just got over in less than 10 minutes, and I was so shocked because I know a lot of people who've had very difficult procedures through the process. But this also brings me to the point that it's also important to find the right dentist. Like, how do we find the right dentist? I mean, when somebody is approaching and they want to start working on how their teeth looks and how healthy it is, how do we find the right dentist?
As a 6-year-old, 7-year-old, I had a lot of dental issues.
Okay.
I was very regular to my dentist, and I had so much of fear of dentists because those days, you remember, all those dental clinics will have low ceiling,
Yeah.
small rooms with all the noisy things.
Yeah.
So I had many pain points in that. And my dentist was wonderful dentist. But the operator that he was sitting in, that created a lot of trauma because it was all small room. It made me so when you are afraid of some procedure and you walk into a place which is very either small, which had all the noises, it amplifies it, right? So, and when I started opal dentistry, my idea was to address all those pain points and also trauma points that I had there.
I get it. Okay.
So when you again walk into any opal dentistry that we have, if you see, all those will be in white walls.
Yes.
It is to create a sense of being this little open spaces. So that's one. And I'm very particular about the ceiling height. As much as possible, it'll be taller ceiling, and most of the operators will be bigger. If not
Actually.
bigger, at least it'll appear bigger.
Yeah.
And all of our equipments would be on your back. It will not be in your vicinity.
That's correct. Okay.
So all that matters because if I'm going to show all my equipments and instruments in your eyesight, it's normal for anyone to be scared.
Okay.
If you remember, your dentist wouldn't have shown the syringe in your
No.
eyesight.
No, he didn't.
Again, interesting enough, dentist is the only profession that you walk into their office, tell, I hate dentist.
Yeah, that's true.
You cannot do that to anyone.
That is true.
You cannot walk into an architect meeting and tell, I hate architect. I don't wish to be here.
That's true. You get to hear that from so many people. But I never knew all of this was so thoughtful because the syringe was not shown to me when I was lying down there. The equipments were not near me. Just a couple of doctors there. I mean, everybody empathized and they made sure that I felt calmer in the process. It was not about, okay, let me just remove. She's another patient. I didn't feel that way. I mean, that is why I wanted to ask, when somebody finds a dentist, it's so important that it is not just about the procedure. It is so many more deeper levels beyond that. I mean, this brings me to another question, which is completely off topic. You're pretty successful as a dentist, and the kind of work that you do is phenomenal. What would you attribute your success to?
I would attribute the success to the ability to change yourself, to improvise on every single day.
Okay.
When I started, I never had a plan or a dream of starting 6 clinics.
Okay.
I never had. And I kept changing my goals every 6 months. So I never had fixed one goal and worked towards it. If I had done it, I would have not done so much, is what I feel. Because as an undergraduate, the tallest dream that I could have is to do post-graduation and go back to my own hometown. And when I was in my postgraduate, the biggest dream that I could have is to have one clinic in OMR and one house in ECR, and I'll be very happy there.
Okay.
And as soon as I'm done with my PG, my dream was to own a practice in K&K.
Okay.
Because at that point of time, K&K was the most happiest place in Chennai.
Yeah.
So I wanted to have one clinic. That was my biggest dream. And after that, I wanted to have one more clinic.
Okay.
And then I took the biggest step and a risk to start one more practice in another city, because most of the doctors that you see would have multiple centers in the same city.
Same city, correct.
And would be concentrated on that one city. And we started one other practice in Bangalore. So that to me was the riskiest thing, because
How did you feel when you made that step?
I believed at that point
Okay.
that was the only way that I can grow, because in Chennai, people were comfortable in traveling to these two practices from wherever they are. I did not find one more reason to have one more clinic
In Chennai.
in Chennai. If I have to grow, I have to be in a bigger city. So I have had one set of patients who had been traveling from Bangalore to Chennai. So I had that belief there. So the ability to change and that resilience and a good wife too.
Were you always a resilient person since when you were a child?
As a child, I used to stammer a lot.
Okay.
So I had the fear of public speaking. So I have to live through it. Again, by God's grace, I had good classmates and everyone. So I was never bullied at that point. But I had this fear inside me. So again, being there as an undergraduate in a field where I have to talk to multiple people, that by itself was a turn that I took without knowing what would happen.
Okay.
Then I took a decision that I have to do my PG, that to in orthodontics. Orthodontics again, it's a field where you have to talk a lot, communicate a lot to the patients. And again, in postgraduates, I have to talk in front of people. But again, that was a step that I took without knowing what would happen. Right? Again, from that point, I kept challenging myself. Again, getting into a place where a place of unrest. And that kind of helped me through it. And also during my post-graduation, I accidentally overheard my professors talking to each other out of concern about me, because one was asking, will he be able to manage talking to the patient? Will he be able to communicate well? I'm more concerned, because they again was genuinely concerned about me, but it was not I just overheard it, a little shaken, because until that day I did not know about it.
Okay.
I did not know that I would not be able to talk to the patient, but I took this as a challenge. And end of my post graduation, I was known to communicate well, meaning I can talk to someone and convince them it's okay to go through that procedure. So I was known for that. Then I already started doing a freelancing orthodontics. By then, I was happy doing that.
This is so amazing. I mean, off camera also, we were having this conversation. This is very inspiring because whatever we go through as children, and if that is a limitation that we see for ourselves or somebody sees that for us, most people kind of create a glass ceiling for them and say, hey, this is the problem. That is why I cannot do what I want to do. But in your case, it's against all odds. Yeah, I have stammering. So what? So what's the big deal? I have so many other things that I can really excel in. And I have goosebumps while I'm saying this. It's actually very, very inspiring. And I'm sure a lot of people who are listening to this, everybody has challenges and everybody makes the challenge so big and they give reasons to themselves as to why they cannot accomplish something because of the challenge. I mean, this is an example of how literally nothing can stop you, because in your industry, like you said, speaking is a crucial part. And yeah, thank you for inspiring so many people and also me. Now, coming back to the oral health, what really causes oral cancer?
Oral cancer, it doesn't have one causating factor.
Okay.
Like every other cancer, your general health plays a major role. And we can divide this into two parts. One is local cause and one is systemic cause. Systemic cause is your other health related, your general health, your genetic, all those things matters. Local causes, it can be your smoking, it can be any form of tobacco, in India, India has the highest population of oral cancer.
Okay.
And among all the other cancers, globally, lung cancer is the most number. In India, oral cancer is the highest percentage.
Okay. And help us understand what happens when somebody chews tobacco or like smokes cigarette. How does it cause cancer?
It has a local irritant factor, and the carcinogens, it triggers mutation of the gum cells, or it can be any cells. So all those things on repeated exposure, it can mutate one cell somewhere, and that can cause cancer.
Okay. Is there like a limit that you can smoke 1 cigarette, 2 cigarettes? No.
Zero.
Zero.
Zero is the best.
So for a layman to understand, how was a cavity formed? And how does it affect the entire oral hygiene?
It requires three substances. One, it requires a bacteria and the food for bacteria, and on the tooth that it stays in a place where the bacteria can go lodge itself.
Okay.
It cannot lodge itself on any areas. That is why you don't get cavity on any surface. You get cavity in a place where the bacteria can go park itself. It can stay there. It should be able to colonize in that area.
Okay.
And that's why in these three factors, the fourth factor, the main factor is time.
Okay.
So again, the bacteria goes there. It stays there for a longer time. It colonizes itself and it multiplies. And these bacteria are acidogenic. So they have the ability to secrete more acid. And these acids, they dissolve the tooth substance.
Okay.
And that leaches away the calcium ion. And once the calcium ion leaches away, the tooth in that area, it gets more soft and blackish.
Okay. And is this also the reason for bad breath people have, or are there multiple reasons for bad breath?
Again, bad breath has multiple reasons.
Okay.
And most of that, it starts from the gut.
Okay.
And it also starts from the teeth, where you see teeth like this, right? You have those areas in between these teeth where again the food can go lodge itself, and that can get fermented in that if you're not cleaning that regularly. And that can create more bad breath.
Bad breath. Okay. And that's why flossing is important.
Exactly.
Okay. And sometimes, yes, after coming and consulting with you, I know I have to brush twice a day. I know I'm wearing Invisalign, but sometimes I get really lazy in the night and I go to sleep without brushing. So help us understand what happens when we don't brush twice a day.
So according to me, brushing in the night is more important than brushing in the morning.
Okay.
I always joke about it because again, brushing in the night is for us and brushing in the morning is for the next person who's next to you. So you have a closed environment for the bacteria for the entire night, right? So entire night there's no again not much of rinsing by the saliva happening in the mouth. So you have a stagnant area. So if you leave some food there, again you have time for the bacteria to come, stay there, and then multiply there.
Okay.
So it's very, 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 very important that you have to brush in the night. Again, brushing in the night is non-negotiable.
Okay. All right. So is there something like specific toothpastes have more benefits compared to the other ones, or is it just a marketing myth?
Personally, I believe all the pastes that you have in the market have identical things, except for a few things extra here and there. But the most important thing that you have to see in all this paste is two things. One, the ability for that to foam, because the foam reduces the surface the tension. Again, it works like a detergent on your cloth.
Okay.
So it has the ability to remove all those surface proteins that is being laid on the teeth. That is one. And two is fluoride content. Fluoride content, because fluoride, when it is applied on the surface of the teeth, it increases the surface, the toughness of the teeth.
Okay.
And it gets more resistance to any bacterial attack.
And what is that one dental myth you wish everyone should stop believing?
If you remove the upper teeth, it's going to affect your brain. 100% it's not going to affect your brain.
Oh, okay.
Every patient who walks into the clinic, mostly the last generation, had this belief that it's going to affect the brain. There's absolutely no connection between the teeth and the brain. It's not going to affect. Only in very rare cases, when you have the infection, when you don't treat it,
Okay.
when you have an issue, and also if you're immunocompromised, that's a lot of things going wrong in one.
Okay. Very, very rare case.
Otherwise, even in that case, the removal will solve the issue or not cause the issue.
And is it important for everybody to remove the wisdom tooth?
No, it's not.
Okay. Then why are so many people recommended to remove the
We
wisdom?
have to understand this from the evolution perspective,
Okay.
right? So, again, 1,000, 2,000 years ago, we used to have hard food,
Correct.
right? And we all had larger jaws. So all these are teeth were able to grow straight when we had larger jaws.
Okay.
And slowly what happened, we started having softer foods and our jaw size shrank a little bit, right? Now our jaw is not able to accommodate that teeth. And that is why it's growing cross. It is not able to come out.
Okay.
If it is fully inside and if it is not affecting the next teeth, it can be left the way it is.
Okay.
If it is half inside and if it is half out, if it is getting infected in that area again and again, we have to remove. If it is fully inside, if it is pushing the other teeth, again it needs to be removed.
Okay. So now, when we talk about wearing braces, right? Like there are multiple kinds. One is the conventional metal one. And then I think 4-5 years back, I was wearing the white color one instead of the metal one. And now I've switched to Invisalign. And I think this is the most convenient one of all the three because that one used to hurt my mouth a lot. Can you help us differentiate this and also recommend what is better for whom? For kids, what is better? And for adults, what is better?
So, if you see braces those days, again 60, 70 years back, needs to have banded onto the teeth. It cannot be stuck on the teeth. It used to be banded onto the teeth. I'll help you with some pictures.
Okay.
So
Perfect.
you'll
We'll be able to add it also, people will understand. Okay.
So it need to be banded, meaning we used to weld a metal strip around the teeth and then the braces used to be fixed in that. It was that tougher.
Okay.
And again, 40 years back, we had this advantage of bonding something onto the teeth, and then the metal braces came. And then ceramic braces are an aesthetic alternative. Functionally, it is not giving you any advantage. It looks little better. Personally, if you ask me, I do not like ceramic braces because of two reasons. Because one, it gets more bulkier. So to understand, I'll tell you, your silver plate, your ever silver plate that you have is usually thin, and your ceramic plate needs to be thicker to have its strength.
Okay.
So your ceramic braces need to be little thicker and bulkier to have its strength. So it has higher friction with the wire. So it is usually not very comfortable for the patient. Might look little aesthetic, so I'm not a fan of it. So in opal industry, we actually don't do ceramic.
Okay.
It goes against our principle because braces there to move the teeth. If it is not doing that well, then why would you do that just because it looks good?
Okay.
So I don't do ceramic braces. And then we have Invisalign system, the aligner system. Aligner system it's an accidental invention.
Okay.
Initially, we used to use that as a retainer. We had a person who was wearing the retainer and he was irregular with that and he did not wear it for 4 to 5 days. And then he wore it back again. It moved his teeth. Then he thought, why don't we use this itself as a treatment? Why is nobody thinking about this?
Okay.
And this person is not even a dentist. And then he's had the initiative to start a brand called Invisalign.
Okay.
And that's how Invisalign was created.
How old is this technology?
This technology is Invisalign is a brand around 28-year-old.
28 years old.
8-year-old,
Okay.
available in US for a very long time.
Okay.
In India, it's pretty new.
Okay.
They are in India for 9 to 10 years now.
Okay. And for children, what would you recommend is the best?
For children, I would say Invisalign is the best thing that has happened to the children. I'll tell you
Okay.
why. Because as an adult, it's kind of easier to initially clean all the braces, because if you eat with braces, you will have food stuck everywhere.
Yes.
And you'll have to spend some time to clean everything.
Yeah.
And usually kids don't clean it that regularly.
Yeah.
And that will leave all those food particles there, and that can cause cavity. If they are not causing cavity, it can cause something called white spot lesion. White spot lesion is one step before a cavity.
Okay.
And once this white spot lesion increases a little bit, it stays there for entire life. It's very hard to reverse them.
Okay.
So you kind of spoil the enamel much earlier. So it gets very tougher through the life to maintain the teeth.
And what do you think would be an ideal age for somebody to come and fix the crowning or fix anything in their teeth related issues?
I would say for alignment, the best time to visit is 8-year-old. 7 to 8-year-old is the best time, where we have the ability to assess the growth pattern and then to see what type of treatment is required at one point of time.
Okay. Is it true that after a specific age, the teeth won't move behind, or is it a myth?
It's a myth, totally a myth.
Okay.
I've treated 82-year-old lady. She's such a sweetheart. The way she was very regular and wearing, the energy that she had.
Okay.
I loved treating her.
So basically, at any age, if we want to realign, it will get realigned.
It will.
Okay, that's interesting. But also, so let's say now my treatment is for 36 weeks. And after that, you had recommended that I wear retainers every night when I go to sleep. What will happen if I don't wear retainers?
See, our teeth actually doesn't know what is irregular and what is regular. So the tooth drifts slowly towards its own comfortable place. And we have aligned them straight for our own aesthetic reason. And that is more healthier too. But the tooth always likes to settle in its own comfortable place, like that of your hair. So if you have to maintain it, you have to wear retainers at least in the night.
Okay, for the rest of the life.
Rest of the life.
Okay. And when people have gaps in between their teeth, either above or below, how does it affect them?
If you have spaces in your teeth, it can be because of many reasons. It can be because your tongue is trying to push the teeth more and more outwards.
Okay.
And there's not much of pressure from the lip to hold it.
Okay.
So if you see, your teeth is in between your lip and your tongue.
Correct.
So tongue gives a centrifugal force, and the lip gives a centripetal force.
Okay.
So it pushes inside, and if you have a difference in these forces, if your tongue wins, it goes outside, it creates space.
Okay.
If your lip wins, it goes inside, it will have an irregularity.
And the next thing I want to ask is, when somebody is constantly chewing gum, does it change their jawline, or is it just a myth that people have?
It can change their jawline.
Okay.
Again, we have muscles of chewing. In that, the main muscles is the masseter muscles.
Okay.
So more you chew, you will develop more of masseter muscle.
Okay.
And it will look little better, but I would not advise everyone to use it more also, because more of masseter also, you can end up clenching your teeth too much.
Okay.
So it's not a good thing.
Okay.
And it's not a bad thing.
Okay, got it. And now the next thing I want to ask is, I saw a video, you with your son, and him asking you how many minutes is it good for you to brush? And you constantly kept saying 3. How many minutes is actually good?
It's 2 to 3 minutes.
So we have to brush for 2 to 3 minutes. And what is the right way of brushing teeth?
Area that you need to concentrate more is the area in between the gums and the teeth.
Okay.
So you angulate your brush.
Okay.
And you keep it in 45 degrees. Approach this area and to have a short vibratory movement. So you concentrate more in this area. And we have to remember again 2 things. All of your back teeth has 1, 2, and 3 surfaces that you need to clean. One outside and one on inside and on the flat surface. and your front teeth has two surfaces. Most of the patient leave the area behind the lower teeth to clean.
Yes. Yes.
And again, surprisingly, we have a gland, salivary gland opening on the floor of your tongue.
Okay.
So it comes out through that and it deposits more of salts in that area.
Okay.
It's like water flowing and then it deposits salts in that area. And that is why most of the patient have more deposits in those areas.
Okay, because it is not cleaned well and there's a lot of salts that come in there. Oh, okay. That's interesting. And how important is cleaning your tongue every day?
It's very important because even the deposits on your tongue can cause bad breath.
Okay. And is there any connection between our oral health and our mental health?
There's a lot of connection.
And what are they?
So, any long-term stress can affect your oral health. We again spoke about that in detail. It's very important because any stress you handle, the easier portion to get attacked is your any mucus covered areas.
Okay.
So if you see your gut is again mucus covered area, again your gums. So all these areas can get affected more and more. And we also shows the autoimmune issues also. It gets expressed in the mouth and any mucus covered areas first.
Okay. Okay, it's because of the stress that it always tends to affect the mucus covered areas in our body first. And gums are also, okay, got it. And now I want to understand. I mean, my husband and I have been talking about this a lot, about smile designing and using veneers. I mean, what are they actually?
Again, veneers, if I have to explain in an easier way,
Okay.
You have a flooring, right? So your teeth is like a normal cement floor that you have.
Okay.
That's again very functional. If you don't have any issues with that, it need not be disturbed at all. But if you don't like the color, texture, or shape of your teeth, again, those things can be changed with veneers. Will I advise veneers for everyone? No. But you have to have some issues with the color, texture of the teeth, if you have any irregular texture of the teeth, or if your tooth has some texture that attracts more stains often, then in our country, again, fluorosis is very common. In few areas, groundwater level has more of fluoride.
Okay.
Even that can cause fluorosis in the teeth. Those will have, again, stains.
Okay.
Again, in those cases, veneers can be done.
Okay. So what are veneers? How, I mean, do you place them on top of the teeth or how does it work?
I'll have to remove, again, 0.5 millimeters of your tooth structure.
Okay.
And then place this on top. So you have a structure of the teeth.
Yeah.
If I just place it on top, then I'll be adding to the bulk.
Correct.
So to equivalent of the size of the entire thickness of the veneers, I'll have to scrape this layer.
Okay.
And then there's something called prepless veneers. Prepless veneers are just placed on top.
Okay.
Again, those can be placed only in places where the tooth is little smaller, and slightly increasing them doesn't hurt.
Okay, got it.
In those areas, I can use prepless veneers. Prepless veneers are not very common in India yet, but it'll be the next big thing to look forward for.
Okay, so veneers are a permanent solution, is it?
Permanent solution.
So when you fix it, do we have to remove it once in a while or it's just done?
It stays there. It stays there at least for 10-15 years. And usually veneers, it stays longer in the teeth if maintained well.
Okay, and for example, let's say somebody has like bigger tooth in the front. Can the size of that be changed by veneers?
Never.
Never, okay.
One thing that we should not use the veneer for is to change the angulation of the teeth.
Okay.
Or to change the entire bulkiness of the teeth.
Okay.
It cannot be done with veneers because, again, like I told you, veneer like a overall covering on the teeth. And one thing that you should never be doing is to do a root canal for the teeth to have a crown on top just for aesthetic reason. If you already have any issues with the teeth, then we can do root canal to overall solve the issue.
Okay.
Again, root canal should never be done to the teeth only for aesthetic reasons.
Okay. Why?
Again, root canal is like mummifying the teeth.
Okay.
It's like you killing the teeth to have a crown placed on top. So
Okay.
any tooth there, the entire life has been taken out because the roots, the entire blood supply has been taken out and
Okay.
then cleaned. So all these things can be done to address any issues that you have. Like if you have a cavity which is deep, and if you have infections, or if you have some sensitivity issues, all those things can be done to save the teeth, not to kill the teeth to save the teeth.
Okay. So only if it is an issue, then we address the issue. We don't do it for aesthetic reasons.
Yes.
And what is smile designing?
Again, it's a umbrella term.
Okay.
So it has many components. Usually, smile designing is misunderstood as only veneers.
Okay.
Again, smile designing is the ability to first plan and design your entire treatment based on how do I want your smile to look at the end of treatment.
Okay.
It can have, again, many treatments, like it can be braces, it can be Invisalign, it can be crowns, it can be veneers, it can be even gum surgeries to again change the architecture of the teeth.
Oh, that's also possible.
It can be even filling.
Oh, okay.
But all those things are done to improve the smile.
Okay.
And then we plan your smile first and then do all this treatment, and we pick and choose. So not every patient would require all of this. For few, it is as good as it would just require cleaning of the teeth. Or it can be very small gum reshaping also. So
Okay.
it need not be an elaborate process for everyone. And for sure, it is not including crown on all your teeth or veneers on all the teeth.
Okay. Got it. Do a lot of people come to you for smile designing also?
Yes,
Yeah?
yes.
And it's purely aesthetic.
Exactly.
Okay, got that. And I want to ask you this question. I mean, do you think a lot of people try to fix their teeth because of insecurity compared to the actual issues that the teeth has?
Again, most of this patient has been putting through their insecurities about their teeth for a very long time.
Yeah.
And then again, I told you about this 82-year-old
Yeah.
lady.
Yeah.
She has been doing that for a long time. Then she like, no, doctor, I want to address this, and I want to address this right now.
Yeah. Yeah.
I liked her attitude.
Yeah.
So this is like, I deserve this. I'm going to have this done for myself.
I think it's very true, because the first time I actually went on to put braces on came from my own insecurity, because I had teeth which are slightly protruding outside and I had really big teeth also. And I used to feel very insecure smiling for photos. But then after I did that, and now that I'm doing Invisalign, it's actually making me comfortable. I teach people how they can feel confident by themselves just the way they are. While that is extremely true, there are certain insecurities that we carry with ourselves for a very, very long time. And if there is a process in a very healthy way to kind of fix that, I think it's a good thing. Because the way I started to smile after I put the bracers and the teeth went inside, I could see the difference for myself, because I was open and smiling because I felt confident on the inside.
I've actually noticed patients through their transformations, right? One good thing that we again always notice is that their entire confidence changes, the way they walk changes, and the way they take care of themselves changes. And it's very, very obvious the way they have their makeup on. It's just refreshing to see, and it's very happy. Most of the patients that I've seen them as a bachelor, and again through their wedding, as their mother, as they enter into motherhood, and it's nice to see the overall transformation.
Yeah, it's very true, because the way you feel about yourself changes completely, because you walk around with so much confidence, and once what was giving you so much insecurity about yourself is fixed at this point of time. And I agree with that. I've had a first-hand experience of that. I want to ask you a bunch of questions. It's just going to be more of a rapid fire. You just tell me an answer with one word or one statement. One dental myth you wish people should stop believing.
It'll be cleaning hurts my teeth, and cleaning makes the teeth with spaces.
Okay, it actually does not.
It
do that.
doesn't.
Okay. Toothpaste or mouthwash, if you could pick only one?
Toothpaste.
Okay. Coffee stains or cavities, what's easier to fix?
I like coffee, but coffee stains, again, I would like to add more on it. Coffee stains doesn't come from coffee. It comes from the acidic nature of the coffee. It
Okay.
makes the area more porous, and then it attracts stain from anywhere.
Okay, it's not the okay, okay, I get it. Okay, nice. The most overrated dental product on the market right now.
It'll be the whitening strips.
Okay. One thing 90% of people do wrong while brushing.
They often feel brushing fast on every area matters. Actually, pressure on the teeth, it doesn't matter.
Okay.
It just need very gentle force, and it's more important to have good technique.
Okay. One food you'd ban if you could for the sake of people's teeth.
Aerated drinks.
Okay. A weirdest thing a patient ever has asked you for.
A weirdest thing was that one patient wanted to have an irregular tooth because irregular tooth looked cute on someone else.
Oh my god. So they had proper
Proper
teeth?
tooth and wanted to have a more irregular tooth with a canine out.
Oh my god, that's so crazy. Okay, floss or tongue cleaner? What's non negotiable?
Floss.
Okay,
Floss and tongue cleaner actually.
both. Okay. Whitening toothpaste, is it actually a fact or a marketing gimmick?
Marketing gimmick, but it can cause little bit of whitening effect, and that's not permanent.
Okay. The one oral health rule you personally break sometimes.
I might not use the tongue cleaner every day.
Okay. If not a dentist, what would you have become?
It's actually a psychologist because I badly want to be a psychologist. I fought with my mother at the end of 12th standard that I want to be a psychologist and I want to do only that.
Okay.
Because this again happened in my, I think, 7th standard or 8th standard, where again one of my friend was caught with some mischievous in the school and he wanted to stop his school.
Okay.
Then I spoke to him. I convinced him not to do that, and I felt so nice about it. So again, from that point, I believe I can communicate. I can talk to people. So I badly want to be a psychologist.
Oh, that's
in
so
my school
nice.
days.
Okay. One thing that instantly makes a smile more attractive.
Confident smile. Confident, happy smile.
Okay.
Often we think the perfect alignment of the teeth matters, but anything confident automatically adds to beauty.
That's true. Most underrated daily habit for a healthy mouth.
Again, brushing with the proper technique, it matters the most.
Okay. Okay. If bad breath had a warning sign, what would it say?
It says some food is getting stored at some point, and that's getting putrefied and fermented in that area.
Okay.
So we have to address it. If not, it'll get into the cavity stage, and then root canal and a crown and this and that.
Okay. And are you a morning person or a night owl?
Night.
Night person. Okay. One piece of advice you'd give your 20-year-old version about mindset and about health.
I would ask my 20-year-old self to dream little faster and bigger, because I always had the habit of taking one step at a time. And until now, I do that. I only worried about the next step that I have to take. So it kind of helps me because I'm not worried with all the worries. I'll make sure the next step that I take will be firm.
Okay.
And that will be well planned one.
Okay.
So I would ask myself to plan a little faster, because I had 1 year in between my UG and my PG where I had my exam preparation. I was preparing for my entrance examination. I had good time because I had the ability to plan my entire day, prepare well, but I wouldn't have wasted that year too.
Okay. Is it like you take that next step so firmly and Ramya has the ability to see the vision for you?
Again, Ramya and me, we work very coherently. So it's like having one more version of me. So Again, Ramya does things where I cannot do.
Okay.
So the way she was persistent, she gets things accomplished the way that I cannot even dream about doing all those things. So I'm more of an analytical person. So
Okay.
I go with numbers. I plan all these things, and Ramya is the left part of my brain.
Ah. That's nice. What is that one question patients ask you that secretly annoys you?
Secretly annoys me when the patient walks into my practice, like, I hate dentists. Like, okay, you need not say that loud. You hate me, okay?
And one dental innovation you're most excited about right now that's happening?
It's a concept called digital smile designing, where you put smile as the goal and then work towards achieving that.
Ah, okay. That's happening now?
Yes.
That's very interesting.
And we have, again, multiple things to add up to it, where we have face scan, and your face can be 3D captured. So I have the ability of having the patient next to me when I do my work in the night.
Okay.
So all these have helped me because, as I told you, I'm a night person. So I work. So this actually enables me to see the patient in person as I work.
That's very, very interesting. Now, I just like to ask you a perspective because, you told me that you're interested in psychology, and that is very curious for me also. So, I talk to people a lot about healing, manifestation, a lot of things. I would like to understand what is your perspective of manifestation?
I would say that envisioning, it need not be a materialistic one. So I had envisioned. So I had planned, and I have manifested freedom
Mhm.
and the power to do things that we want to do.
Mm.
Right? This is actually not anything materialistic that I have thought through, but this is a concept that I always believed in.
Mm.
And I believe that has driven me to the place where I have now have a team to execute the exact way I want those treatment to go. So all these, I believe, have its roots in that.
It's so true because the materialistic goals that you just said, that you don't focus on that, you focus on the feeling of freedom and the ability to do the right kind of things. So the materialistic things that people want in life are the means goals, and this is the end goal.
Okay.
So it's always easier for people to achieve what they want in their life when their fixation is on the end goal. Like how it is for you. It's about the freedom. It's about that feeling that I want to feel. How it's going to come, everything on the outside will happen for it to happen.
Exactly.
You don't know manifestation, but you pretty much are doing that on a regular basis. That's very nice. So one final thought for everybody who's listening, what would your message be for them?
I believe confidence, anything added to the confidence, just beautiful. If you smile with confidence, it's the most beautiful smile. So again, confident roots from the fact that you are comfortable
With
on
yourself?
your own self. I think that matters the most.
It's so nice. I love the fact that you never spoke anything about fix your teeth, do this and do that. And you spoke about something which is so inherent to people, which is confidence. And when you use that when you're smiling, irrespective of how you look, it just passes on that energy. It's so beautiful. I had such an amazing conversation with you, and it's so nice to have Rami also here. Thank you so much for doing this, and I'm sure a lot of people are going to get benefited by whatever you shared. And I'd love to convey this to you. You're definitely an inspiration for a lot of people.
Oh, thank you so much for having me. It was wonderful to be here. I initially, I did not even know what I'm going to talk today, but it was wonderful to be here.
Thank you so much.
Thank you.